Can an HSG test cause infection or complications? Imagine getting a simple test to help understand your fertility better. An HSG, or hysterosalpingogram, is a common procedure used to check the shape of the uterus and see if the fallopian tubes are open. While it is generally safe and well tolerated, like any medical procedure, it can carry some risks. The most notable concern is the possibility of developing a pelvic infection. This risk is higher in women who have a history of pelvic infections, such as chlamydia, or who already have tubal disease. During the test, bacteria from the vagina can sometimes be pushed into the uterus and fallopian tubes, leading to infection. Symptoms of an infection might include increasing pelvic pain, fever, foul-smelling vaginal discharge, or vomiting. If you notice any of these symptoms after the procedure, it is very important to contact your healthcare provider immediately. Other rare but possible complications include allergic reactions to the contrast dye used during the test. These reactions are uncommon but can involve symptoms like rash, itching, swelling, or difficulty breathing. Mild cramping and light vaginal bleeding are quite common and usually resolve within a few days. Feeling faint or dizzy during or after the test can happen but is also rare. Very rarely, the uterus can be injured during the procedure, which is called perforation, but this is extremely uncommon. In even rarer cases, the contrast dye might enter the bloodstream, which can be serious but is very unlikely. The amount of radiation exposure during an HSG is very low and generally not harmful, even if pregnancy occurs later in the same cycle. However, it is important to avoid having the test if pregnancy is suspected. For women with endometriosis, the HSG can help rule out other causes of infertility, but it does not diagnose endometriosis itself. The risks and complications are similar whether or not a woman has endometriosis, but women with a history of pelvic infections or tubal damage might face a slightly higher risk. Most women experience no serious problems after an HSG. The procedure is usually well tolerated, and any discomfort or minor side effects tend to go away quickly. If you are worried about infection or complications, especially if you have a history of pelvic infections or endometriosis, it's best to talk with your healthcare provider beforehand. They can help you understand your personal risk and tell you what signs to watch for after the test. Remember, always seek personalized advice from your doctor to ensure your safety and peace of mind.